All right, so today we have three goals, and we'll break it into three parts. First, we have to discuss the difference between continuous and graded exercise and how steady state is part of that. Secondly, we have to describe gross efficiency, so we're going to define it, and we're going to take a look at what it takes to calculate it. And then lastly, we're going to go through an example using a rower ergometer and see how to actually calculate efficiency in lab. So, beginning with graded versus continuous exercise, they're two different modes, and they are exactly as described. Continuous means you start and you go at one pace for a long period of time, and graded means it's graded, so the intensity will be changed and increased stepwise to a certain point. Now we have what's called a graded exercise test, or a VO2 max test is sometimes what it's called, which means you increase and increase and increase until you achieve a peak. So first of all, with continuous exercise, the duration that you go is always limited by the intensity that you start at. So if we see here, we have an x-axis of time and a y-axis of intensity. If we start at a very high intensity, the duration is going to be short and it's going to escalate throughout. If we decrease the intensity a little bit, we're still going to see an increase in all of our physiology, but we can go a little bit longer. Now, as the intensity decreases, that line levels out. So we can go further, okay, and our body responds a bit more slowly. Until we get to a point where that line gets awfully flat and our duration gets awfully long. Now, on their own, any one of these is sometimes called a time to exhaustion test, which means that we fix the power output, or the amount of fix the power output, that is the intensity, and allow somebody to go to exhaustion. And if you do a whole series of these, the point at which somebody is able to continue for a very, very long time is sometimes called a critical power test. So any one of these you could call time to exhaustion. If you do them all again, looking for that point at which you can continue almost indefinitely, you have a critical power. So, if intensity is measured as power output, on a graded exercise test, we can see that we are increasing the power output incrementally. So let's say we're on a bike, we would begin at 50 watts, then 100 watts, then 150 watts, 200 watts, and then up here 250 watts, and let's say that's where the test ends. Okay, so even a little bit shorter, maybe we don't quite finish that stage. So how does our body respond physiologically? Well, on the ergometer, it's simple. It's nice straight lines because we're increasing the amount of work. But our body, let's say heart rate, okay, or VO2, or in this case sometimes even ventilation, depending on what you're after, is going to respond a bit differently. It's going to come up and flatten out, and then it has to respond and flatten out. It's 2 stages. Respond and flatten out, 3 stages, and respond, and then say it doesn't flatten out, it keeps increasing, and then lastly it just increases to the end. So what we can see is that these sub-maximal workloads, at the end of them, we achieve what is called steady state. Now, once we get past a certain point, usually called the anaerobic threshold, we see that it's a lot more difficult to achieve steady state in a short period of time. Okay, so up here, if we're going to measure that, we'd see there's actually still a slope, whereas down here it's relatively flat. This is also part of what we talked about earlier in continuous exercise. So even at low intensities, you'll see a small increase, okay, a very small increase. But at higher intensities, you see a rather large increase. So we have to have some criteria to determine whether we've actually achieved a steady state. So if we look at a chunk of time, we can say, yes, you are in a steady state. That is, nothing is really changing physiologically. It's stabilized, given the amount of work you're doing. Or you're not in steady state. Okay, your physiology is continuing to ramp up. So what are the criteria? Well, what are we measuring here physiologically? Heart rate, VO2, ventilation. So those are our criteria. So heart rate, easiest one to measure, is plus or minus 5 beats per minute. So go 1 minute, heart rate's at 150. Go another minute, it has to be between 145 and 155. Second would be VO2, okay, or VCO2, very common measurements, have to change by less than 150 mils per minute, which is the same as 0.150 liters per minute. Okay. So we need the metabolic cart to determine that one. Lastly, sometimes we're measuring blood lactate. We'll talk about that when we talk about the anaerobic threshold. It has to be stable. So usually a change of less than 1.0 millimole. And lastly, we could pick another indicator. So exactly ventilation sometimes, we could say it has to be within 6 to 8 liters per minute. And there's this fourth one can be interchanged with several different variables, but ventilation is fairly common. So that is continuous versus graded exercise. And that finishes the first part of our video.